Hey everyone, welcome to Imaging Study. Today we're going to see a case of Foregut Duplication Cyst of the tongue. This is a 7-month-old baby who came with a swelling at the dorsal aspect of the tip of the tongue at this part. So the tongue is always kept outside the mouth, so she can't put it back into the oral cavity. So let's see what we have got on ultrasound. Here on high frequency ultrasound, you can see a cystic area at the dorsal aspect of the tip of the tongue. You can see it has some septations inside and the surrounding wall is quite thickened, which is a very important feature to diagnose a foregut duplication cyst. And you can see internal low-level echoes. These are moving particles within, and it's not painful. I tried to press a little bit. The baby was very cooperative and didn't cry. So it's not a painful one, so you should exclude the abscess. The clinician sent me this patient to exclude vascular malformation. Actually, he or she was thinking about some venous malformation or something like that. But you can see these are just some moving structures on compression. So these are low-level echoes like inflammatory contents or something else. Let's see from different angle. Now here you can see a little bit stable one, and you can see some low-level internal echoes quite like the endometrioma, I think. This is not endometrioma, definitely. So the wall is quite thickened and it's located within the dorsal aspect of the tip of the tongue. So here's the picture. You can see some folds or septation inside it, and the wall is slightly thickened. But there is no feature of inflammation here. So we want to check it with Doppler also, because the clinician wants to exclude vascular abnormality. Now here on color Doppler, you can see there is no internal vascularity. These are the regular tongue vascularity. Tongue is highly vascular. So if you put color Doppler in a normal tongue, you will see a very high vascularity inside. So it's very difficult to exclude tiny lesions having vascular malformations within a vascular tongue. But it needs a little bit practice. So here we can see this lesion is not a vascular one, rather it's just having the regular wall vascularity or something like that. In summary, you can see an oval cystic area with thickened wall and internal homogeneously hypoechoic collection, showing internal septation within the dorsal aspect of the tongue. So this features concluded as a case of foregut duplication cyst of the tongue. You definitely should go for an FNSC, or you can do an MRI for further confirmation. Now the take-home message. Not all the tongue lesions are the vascular malformation, so just get rid of that concept. Use high-frequency ultrasound, use color Doppler, and then you can easily diagnose the lesion. So thank you for watching this video. Don't forget to subscribe our YouTube channel, and if you're new, we are trying to post many videos in our YouTube channel in near future. So please be with us, and don't forget to share this video with your friends. See you on the next one. Have a nice day.